The LIC offered a larger scope than I think I would have been able to get in a traditional clerkship, especially from the get-go. I was exposed to a lot of different specialties early on, which feels intimidating at first, but then you get to really know the clinic and the providers, and you feel comfortable in a large variety of settings. And by the end of the year, I really felt comfortable knowing that I could go jump in anywhere and figure out how to be useful and get to know the patients in that clinic.
We think that ultimately this model for teaching benefits all medical students. Students in general will learn better when they can follow a patient with whom they have a close connection through the continuum of their care, through multiple phases in their healthcare journey. We also think that medical students learn best when they are partnered with surgeons or physicians who know who they are as people and know their strengths and weaknesses and can continually come back to those strengths and weaknesses and help them progress to meet the goals that they have as individuals and as future physicians.
On a Monday morning, you might be doing family medicine. On a Tuesday, you might be in OBGYN clinic seeing a pregnant mom. And then the next day on a Wednesday, you might be in the hospital and you might be helping to take care of the baby and take care of that mom that you just saw the day before.
They may spend a morning with an internal medicine physician in their clinic and an afternoon with a surgeon in their clinic. And that is the intent of this model of learning. And it's very meaningful for students, preceptors, and patients.
One of the biggest benefits of the LIC was the flexibility that it offered. For instance, I found out pretty quickly that I wanted to do OBGYN, and I was able to arrange my schedule so that I could be there for my patients' follow-up appointments for their prenatal care and then follow them to delivery and then see them after their delivery. The flexibility that was given by the schedule with the LIC is really what made that possible.
Those medical students are going to start being helpful, and they're going to start being, a high-functioning provider that will need you to guide them and teach them, but will be able to kind of be a second you, go in there and get great information from patients and give patient care and be able to take some of the burden or some of the load from you. And they're gonna do it with a passion and a zest that only a medical student can bring.
As you know the medical student that you're working with, you trust them and you trust their exam skills because you know what those skills are. It's not a student that you've never met before that you don't know if they can accurately diagnose this condition or that condition. It's someone that you've worked with multiple times and you know their knowledge level.
With the LIC, they might recommend a treatment for a patient, and then 2 months later when the patient comes back, the students will get to see whether their treatment worked, what's the next steps. They'll get to follow through on their initial plan, and I think get a better learning experience from it.
It's a new perspective that they are bringing to that patient. I love that with our students. They are always bringing great new ideas and perspective and boundless energy.
I saw a patient with type 2 diabetes who was hoping to be referred to bariatric surgery, but had a lot of health issues that she was trying to get under control before she was able to do that. And I was able to work with her pretty frequently in clinic. About every other time that I was in family medicine clinic, she was in to follow up on her test results or her medication, and it was really rewarding to be able to follow her the whole year and then get to see her in specialty clinic as well.
The LIC program will really change the way that our medical students are taught and will allow them to really engage in the medical system and in the medical site that they're located, and will allow them to come in with a confidence and grow confidence that will allow them to take that next step to go from medical student understanding the site to, hey, I'm a provider and I'm excited about giving medical care, and I'm excited about seeing patients and giving quality personal health care.
Students in an LIC, just by the nature of its schedule, where they may go from one clinical experience to the other in a very varied clinical setting, requires them to be flexible. So they may spend the morning with a pediatrician and the afternoon with an obstetrician, both of which are very different experiences in terms of the culture of what they might find. And it really requires them to be flexible and resilient. And I think those are two incredibly important characteristics of future physicians.